Welcome to Fertile Minds. My name is Professor Hayden Homer. I am a CREI accredited fertility subspecialist with the Queensland Fertility Group. I'm going to speak to you about the causes of miscarriages. So what is a miscarriage? A miscarriage is a pregnancy loss before 20 weeks, which is roughly 5 months. And recurrent miscarriage is the loss of more than one pregnancy, usually defined by the loss of 3 consecutive pregnancies, although that definition does vary from country to country. For example, the Americans define it as the loss of 2 clinical pregnancies that don't need to be consecutive. How frequently does recurrent miscarriage happen? It's thought to happen in about 0.5% of couples. An important point about miscarriage is that the rate of miscarriage is really dependent upon female age. So as women get older, the background rate of miscarriage increases quite markedly. So for women under 35, miscarriage rate is roughly in the region of 10 to 15%. Whereas in the age group 35 to 39, it goes up to 25%, and above 40, it's 50 to 80%. So when you speak about background miscarriage rate, it really depends on female age. Coming back to recurrent miscarriage, it's when you calculate the rate of recurrent miscarriage in the population, it is also dependent on female age. Given the change in background rate. Overall, we think the rate of recurrent miscarriage is 0.5%, but it can be as high as, say, 13% in women in their 40s. In terms of what are the causes of recurrent miscarriage, well, the commonest cause of miscarriage in general is a chromosome abnormality in the embryo. And those chromosomal abnormalities increase as women get older. So roughly 50 to 60% of early pregnancy losses are because of a chromosomal problem in the embryo. And almost all of these are sporadic errors that occur while the egg is maturing. So it's not as a result of inherited chromosomal abnormalities in the parents, but often because of sporadic errors. In patients with recurrent miscarriage, there is, however, an increased rate of chromosomal problems in one or both parents. Most usually, it is a reciprocal translocation, so where bits of chromosomes break off and exchange with one another. The rate of that happening in patients with recurrent miscarriage is in the region of 5%. So it's quite high because the background rate of these abnormalities in the population is well below 0.5%. So that's chromosomal problems. Another cause of recurrent miscarriage is something called antiphospholipid syndrome. Antiphospholipid syndrome is a condition in which there's a propensity to form blood clots in the small vessels, and we think in the small vessels of the placenta. And this then leads to improper embryo development and miscarriage. Antiphospholipid syndrome is often associated with other adverse pregnancy outcomes beside miscarriage, such as a previous preterm birth, a previous undergrown baby, or previous severe high blood pressure in pregnancy. And some patients also have a history of clots in the veins. The third major cause for recurrent miscarriage is a structural problem in the womb. So the womb, otherwise known as the uterus, is where the embryo implants. And if there's any problem with the lining, a structural problem, this can lead to miscarriage. So the 3 common groups of problems in the lining that can lead to miscarriage firstly polyps. So polyps are little skin tags inside the lining. There are another cause is fibroids. Fibroids are fibrous growths in the muscle of the womb, and if they stick into the lining of the womb, they can cause miscarriage. Fibroids are quite common, and anywhere from 40 to 80% of women will have fibroids, but the vast majority of them won't have a problem with miscarriage. And the third major uterine structural problem is a uterine septum. Ordinarily, in the general population, septal problems are quite rare, but in women with recurrent miscarriage, the rate is as high as 6%. So collectively, in women with recurrent miscarriage, the chance of having a problem with the structure of the womb is about 20%. In terms of treatment for recurrent miscarriage, well, the established treatments target the cause. So clearly, if there's a structural problem like a fibroid or a septum, these can be removed with a special type of surgery where a telescope is inserted into the womb, and through that telescope, surgery is performed to remove the offending agent like the fibroid or the septum. That's called hysteroscopic surgery. In the case of antiphospholipid syndrome, the treatment, the evidence shows quite clearly that there's a benefit by using heparin combined with aspirin. So both of these are blood thinning agents, if you like, and those are used throughout the majority of the pregnancy. In the case of chromosomal problems in the parents, obviously these can't be corrected in the parents, but one option might be to test embryos for the chromosomal problem and to select those embryos that don't carry the problem. And the way you can do this is through IVF and a technique called pre-implantation genetic testing, where the embryo, a sample of cells from the embryo is biopsied and examined for the abnormality. And if it's found to be free of the abnormality, those embryos are then transferred. Another really important part of management of recurrent miscarriage is known as TLC, or tender loving care, and it's about closely monitoring the early pregnancy with serial ultrasound scans and blood levels to provide reassurance that everything is going okay. It's important to know that with recurrent miscarriage, in spite of how devastating 3 pregnancy losses can be, in at least 50% of cases, no major abnormality is found. And this is called unexplained recurrent miscarriage. So these patients present a bit of a conundrum because it's a highly stressful situation to be in where 3 pregnancies have been lost but no cause has been found. And one of the things that seems to be beneficial in this group of patients, apart from TLC, is progesterone usage. But progesterone needs to be started very early in the pregnancy and continued through, typically I would continue it at least through the first 8 to 12 weeks. When would you see a specialist for miscarriage? Well, there's no real hard and fast rule. One general indicator of the significance of the history in terms of when to seek advice is stage of pregnancy loss. So a very early pregnancy loss before anything's appeared on an ultrasound, and these kinds of losses are called biochemical losses. They're only detected by a positive pregnancy test, either in the blood or the urine. These early losses are very common, and we think that at least 40% of all pregnancies are lost at this stage. The later on in pregnancy you get, the less likely it is for the pregnancy to fail. So once there's a fetal heartbeat, for example, the predicted good outcome is about 80 to 85%. So losses after that stage start to suggest that something might be going on in the background that you might investigate. So as much as recurrent miscarriage is defined as 2 or 3 consecutive losses, it doesn't mean you need to wait that long before you seek advice. Because of course 3 losses started as 1 initially. So and the hint as to when the urgency to seek assistance is in addition to how many you've had, how far along they've been lost. So the further losses, it's more likely that there might be something to find, and that's treatable to prevent further loss. Miscarriages are unfortunately quite common and very heartbreaking. So finding out the reasons are important for improving your outcome the next time around. I hope you found this video helpful, and I would encourage you to subscribe to our channel to find out about our other videos on fertility.